Spinal anesthesia is one of the most trusted, precise, and time-tested techniques used in modern anesthetic practice. It offers a unique combination of rapid onset, profound pain relief, and excellent surgical conditions while allowing the patient to remain awake, comfortable, and fully aware of their surroundings. In this narration, we will take you step by step through the entire journey of spinal anesthesia, from preparation, positioning, and needle insertion to surgical management and recovery, so you can clearly understand the workflow, the purpose behind each stage, and the level of care and coordination involved in keeping the patient safe. The process begins even before the patient enters the operating room. A thorough preoperative evaluation is carried out, as this step lays the foundation for a safe procedure. The anesthesiologist reviews the patient's medical history, including past surgeries, medications, allergies, and any previous experiences with anesthesia. Special attention is given to conditions such as heart disease, blood pressure problems, bleeding disorders, or spine-related issues, because these factors guide how the spinal anesthetic will be administered. The anesthetist listens to the patient's concerns, answers questions, and explains the entire plan in clear, comforting language. This conversation not only helps reduce fear and anxiety but also ensures informed consent, which is a vital part of the process. Once medically cleared, the patient is shifted into the operating room. The environment may feel cold and bright, but every detail, from lighting to equipment, has a purpose. The patient is connected to essential monitors so the anesthesia team can constantly observe heart rate, blood pressure, and oxygen saturation. An intravenous line is established, providing a channel for fluids and medications. Throughout this entire process, the patient is spoken to with reassurance, because maintaining calmness and trust is just as important as technical precision. The next stage is positioning, a crucial step that determines the ease and success of the procedure. The patient may be seated upright on the edge of the operating table or placed in the lateral position, lying curled on their side. In both cases, the goal is the same: to create an exaggerated arch in the lower back. This widens the spaces between the vertebrae, allowing the spinal needle to pass smoothly into the subarachnoid space where the cerebrospinal fluid flows. The anesthesiologist guides the patient through this posture, asking them to bend forward gently without straining, as slight adjustments can significantly improve access to the spine. With the patient in position, the lower back is cleaned meticulously with antiseptic solution. This step is repeatedly performed in widening circular motions to eliminate the risk of infection. Once the skin is disinfected, the area is covered with sterile drapes. From here on, the field around the spine is treated with complete sterility, just like a miniature surgical site. The anesthesiologist palpates the bony landmarks of the lumbar spine, typically locating the L3, L4 or L4, L5 interspace. This level is chosen because the spinal cord ends above L2, making the lower lumbar region the safest place to inject. Before inserting the spinal needle, a small amount of local anesthetic is injected into the skin to numb the area. The patient may feel a tiny pinch or slight burning sensation, but this discomfort fades quickly. The spinal needle, thin, delicate, and carefully engineered, is then advanced slowly through the tissues. Each layer offers a different tactile feedback to the anesthesiologist's hand. And the moment the needle enters the subarachnoid space, cerebrospinal fluid begins to appear at the hub of the needle. This clear fluid confirms perfect placement, and the patient is reminded to stay still and relaxed. Now comes the heart of the technique, the injection of anesthetic medication. A measured dose of local anesthetic, sometimes combined with opioids, is gently pushed into the spinal fluid. Unlike general anesthesia, which acts on the entire body, spinal anesthesia works directly on the nerves that carry sensations from the lower body. Within moments, the patient begins to feel warmth or tingling traveling down the legs, followed by numbness and inability to move the lower limbs. These sensations are expected, and are explained beforehand so the patient feels reassured rather than alarmed. As the anesthetic spreads upward through the spinal fluid, it blocks nerve signals that carry pain and movement from the surgical area to the brain. The anesthesiologist checks the level of numbness by gently touching or lightly pricking the skin, ensuring the block is adequate for the type of surgery planned. Once confirmed, the patient is positioned comfortably for the operation. The lower half of the body becomes completely numb, but the patient remains awake, breathing normally, and able to hear and communicate. If desired, mild sedation may be administered to keep the patient relaxed without affecting consciousness. The surgical procedure now begins, and while the surgeons focus on their task, the anesthesiologist's attention remains on the patient. Blood pressure, heart rate, oxygen levels, and the depth of anesthesia are continuously monitored. Since spinal anesthesia can lower blood pressure due to nerve blockade, fluids or medications may be administered to maintain stability. Throughout the operation, the patient is spoken to gently, reassured, and kept comfortable.